Welcome back, everybody, for another deep dive. This time we're getting into something that might not be the most exciting on the surface, but is a cornerstone of healthcare. Integumentary System coding guidelines.
Yeah.
We're talking about making sure doctors and hospitals are getting paid accurately for any work they do on, well, skin, hair, and nails, the integumentary system. And I'm not going to lie, I'm a little intimidated by just how specific these guidelines get.
Oh, yeah.
But you and I both know our listeners like to get into nitty-gritty, so that's what we're going to do.
Absolutely. We'll become mini experts together without having to spend hours and hours with those giant manuals.
Right. No one has time for that.
Okay.
Okay, so to kick things off, I got to ask, why do these guidelines even exist? What's the big deal?
Well, imagine if there weren't these standardized codes.
Oh, chaos.
Every single doctor could bill differently for the same exact procedure.
Right.
It would be a nightmare for everyone, from the healthcare providers to the insurance companies. These guidelines basically create a universal language for billing.
So everyone's on the same page.
Exactly.
That makes total sense. But I'm guessing it goes deeper than just having a code for, say, removing a mole.
Way deeper. These guidelines get super specific. They specify the size of the lesion, where it's located, how deep a procedure goes, even how certain procedures are bundled together.
Okay, bundling. You got to break that down for me.
Sure. Think of it like a combo meal.
Okay.
You get the burger, the fries, the drink, all for one price. In medical coding, bundling means certain procedures are grouped together under one code because they're usually done at the same time.
Ah, so it's like if you get a benign lesion removed, the code for the excision also includes closing the wound. You wouldn't bill for those separately.
Exactly. It's more efficient, plus it reflects how those procedures actually happen in real life.
Right, it's all connected. Makes sense. But what about when things get a bit more complicated, like if there are multiple procedures or something unique about the situation?
That's where modifiers come in. They're like add-ons to the main code that give extra information. Like, say a procedure is done on a separate lesion. You'd add a modifier 59, actually, to show that.
So it's like customizing your combo meal, adding some extra topping.
Exactly. It's all about capturing the little details of each case.
Okay, this is already making me think a little harder than I expected, but I'm starting to see the logic. So if this covers the entire integumentary system, we're talking about a ton of procedures, right?
Oh, yeah.
Everything from biopsies and excisions to more complex things like grafts, treating burns, even Mohs surgery. Each area has its own set of rules. Okay, so where do we even begin to dive into all of this?
Well, you mentioned biopsies earlier, and we start there. They're really fundamental for diagnosing all kinds of skin conditions.
Okay, biopsies. I think almost everyone's either had one or knows someone who has.
Yeah.
They're different types, right?
Absolutely. There are needle biopsies, like fine needle aspiration and core needle biopsy. Those are often used for suspicious growths. Then you have punch biopsies, where they take a small circle of skin, and incisional biopsies, where they take a bigger sample.
And I'm guessing each type has its own specific code.
You bet. And to make things even more interesting, the coding also changes based on whether they used imaging guidance, how many lesions they biopsied, stuff like that. Say a doctor used 2 different types of imaging to guide a biopsy, they might need to use that modifier 59 we talked about.
Wow, so much detail for just one procedure. I started to see why staying updated on these guidelines is so important.
It definitely is. But let's move on to another common one. Excisions.
Okay.
This is where they completely remove a lesion.
Great.
And the code changes based on whether the lesion is benign or malignant, how big it is, and where it is on the body.
So if I have a mole removed, the code would be different if it was cancerous or not, how big it was, and if it was on my arm versus, say, my back.
Exactly. And to add another layer, simple closures, like stitching up the wound, are usually bundled into the excision code.
So again, it's about reflecting how these procedures actually happen in practice.
Precisely. No extra charges for something that's really part of the same process.
Okay, it's starting to click.
Yeah.
But I have a feeling we're just scratching the surface, right?
Oh, absolutely. We haven't even touched on repairs, which have different levels of complexity, or skin grafts, where the code changes based on the type of graft, how thick it is, and where it's placed.
Wait, different levels of complexity for repairs. Like stitching up a paper cut is different from repairing a deep wound.
You got it. A simple repair is for a straightforward wound, while a complex repair might involve multiple layers of tissue, or even using tissue from a nearby area to close it.
Using tissue from nearby, huh? Okay, now you're speaking a whole other language.
Don't worry, we'll get there. But before we jump into those details, how about we shift gears and talk about breast procedures? They have their own set of coding guidelines.
Oh, okay. Sounds like a whole other world. I'm ready. Breast procedures. Okay, it feels like we're going from Dermatology 101 to like a specialized masterclass in coding.
Yeah, kinda. The breast is its own thing with unique anatomy and procedures, so the coding gets pretty specific. But the good news is a lot of the stuff we talked about still applies.
Okay, that makes me feel a little better. So where do we even start with breast-specific coding?
Let's start with biopsies, just like we did with skin. They're super important for diagnosing breast problems, everything from cysts to, well, cancer.
Yeah, those biopsies are often the first step to figuring out what's going on.
Exactly. And the coding depends on things we've already talked about, what kind of biopsy they did, if they used any imaging to guide it.
So like a fine needle aspiration biopsy guided by ultrasound would have a different code than a core needle biopsy without imaging.
Exactly.
Just like with those skin biopsies.
Okay. Yep. The codes for breast biopsies are all in the 19081-19126 range. And here's that bundling concept again. If a biopsy leads to removing a cyst or lesion, that removal is bundled into the biopsy code.
So again, it's efficient, and it makes sense because in reality, they happen together.
Right. It just reflects the actual flow of things.
Makes sense. But what about those cases where they have to do something before the biopsy to make sure they're biopsying the right spot? I've heard about procedures where they put in a marker or a wire.
Oh, you're talking about localization procedures? It's like setting up a GPS for the surgeon?
Okay.
Those procedures are coded using the 19281-19298 range. And this specific code depends on a few things.
Like what? Give me the details.
Well, did they do a biopsy at the same time as the localization? What kind of imaging did they use to guide it? What kind of localization device did they use? A wire or a radioactive seed? All that stuff affects the code.
It's kind of amazing how much goes into picking the right code. You can't just look up breast biopsy and be done with it.
Nope, not at all. Okay, but let's move on to something that's often the next step. And unfortunately, a lot of women go through it, mastectomies.
Yeah, that's a heavy one. I imagine the coding reflects how complex that procedure is.
Definitely. We use codes 19294 and 19300, 19307 for mastectomies. But choosing the right code depends on whether it was a partial mastectomy, where they remove part of the breast tissue, or total mastectomy, where they remove the whole breast.
And what about lymph node removal? I know that's often done along with a mastectomy.
You're right, and that would be coded separately. But here's that bundling concept again.
Okay.
Any excisions or placements of imaging markers that happen as part of the mastectomy are bundled into the main mastectomy code.
So even though it's multiple steps, the coding system kind of sees it as one whole thing, which makes sense, right?
Right. Makes things smoother for billing and makes sure patients don't get a bunch of separate charges for what's really one procedure.
Learning about this coding system, even though it's complex, honestly makes me feel a little more empowered as a patient.
Oh, I'm so glad to hear that. That's one of the reasons I love this stuff. When patients understand even the basics of coding, they can ask better questions and be better advocates for themselves.
I couldn't agree more. But I gotta say, we've covered a lot, and I feel like we're just starting to scratch the surface of these integumentary system coding guidelines. What else is hidden in these manuals?
Well, we've talked about biopsies and excisions, but there's a whole other world of procedures that focus on repairing the skin.
Okay.
And just like everything else, the coding for those depends on how complex the repair is, what techniques they used, and even what part of the body we're talking about.
Repair coding, huh? Okay, you've got me intrigued.
Good. We're talking about everything from simple closures, like stitching up a small cut, to way more complex stuff involving skin flaps, grafts, even skin substitutes.
So stitching up a paper cut versus doing a skin graft after a burn, those are totally different codes.
Totally different. And how complex the repair is changes the code. A simple repair is for a straightforward wound, while a complex repair might involve multiple layers of tissue or even using tissue from a nearby area to close the wound.
Using tissue from nearby. Okay, now I know you're speaking another language.
Haha. Well, it is pretty specialized, but the point is the coding captures those nuances.
Right. So it's not just what they did, but all those specifics about how they did it.
Exactly. All those details help make sure healthcare providers are getting paid fairly for their expertise.
I'm seeing a pattern here. It's all about accuracy, reflecting those tiny details.
It is. It's like solving a puzzle where each piece matters.
This is fascinating stuff, but my brain is starting to feel full.
I hear you. We've covered a lot of ground. Maybe we should take a break before we get into burns, Mohs surgery, and all that.
Yeah, let's pause here and let everything sink in a bit.
Yeah.
Okay, so we've made it through this medical coding maze, And honestly, I'm kind of amazed by how much detail goes into it.
It's a lot to take in, that's for sure.
But I think what's interesting is that even though it's complex, there's a clear logic to it.
Yeah, definitely. It's like a giant puzzle, and all those little details are the pieces.
Right. And when you put all the pieces together, you get an accurate picture of what happened and how it should be billed. And that protects everyone, right?
Exactly. Doctors and hospitals get paid fairly, which is important for, well, the whole healthcare system. And on the patient side, it helps avoid mistakes with bills and make sure you're not paying too much.
So it's really about fairness and transparency for both sides.
That's the goal. Of course, it's not always perfect. There are going to be some tricky situations, gray areas.
Which leads to my next question. If these guidelines are so specific, how do people even keep up with them? It seems like a full-time job just to know all the codes and rules.
It does take work. But there are resources to help. Groups like the American Academy of Dermatology, the American Medical Association, and CMS, they all put out updates and guidance on how the coding changes.
So it's like having a team of coding experts in your corner.
Exactly. And there are workshops and online courses that can really dive deep into specific coding topics.
So anyone listening who's feeling overwhelmed, there's hope. You don't have to be a coding master right away. There's support out there.
Exactly. And even just knowing the basics can help you as a patient. You can understand your bills better, ask good questions, and speak up if something doesn't seem right.
It's about taking charge of your own healthcare.
Absolutely. And that's what I love about this. It's not just codes and rules. It's about helping people navigate this complicated system and making sure they're getting the care they deserve.
Well said. So, as we wrap up, what's the one thing you want listeners to remember?
I think the most important thing is that the Integumentary System coding guidelines, even though they're complex, exist for a reason, to make sure medical billing is fair and accurate. And the more we understand the basics and stay updated, the better it is for everyone.
Love it. And for our listeners, I'll leave you with this thought. How might knowing about these guidelines change your own healthcare experience? Whether you're a patient or a provider, it's something to think about.
That's a great point. And remember, this stuff is always changing, so stay curious and keep learning.
Absolutely. Until next time, keep exploring, and may all your medical bills make sense.